Good morning, Dr. Michael Reardon. Thank you for joining me on the Valder Beebe Show here in Dallas, Texas. How are you, and happy holidays?
Well, I am fine, and thank you for having me on. I like
Well,
Dallas.
you've got some great information, and Dallas is a great place that will be so receptive to this with my audience. I want my audience to know I'm speaking with Dr. Michael Reardon. He's a cardiothoracic surgeon, and he believes how about Americans are being diagnosed with the heart valve disease every year, and maybe give us some clarity on that. Dr. Reardon, you think or you say there are about 5 million Americans diagnosed with heart valve disease each year. That's quite a number.
It's a large number, Valda, and it's a number that's going to grow as our population continues to age. And of course, the most common one needing treatment is aortic stenosis. And as your aortic valve gets worse, the aortic valve is a valve that lets the blood out of the heart to the rest of the body. It narrows down. It makes it harder for the heart to pump. And eventually you'll get symptoms of shortness of breath, fatigue, chest pain or discomfort, dizziness or fainting. And once you get those symptoms, it's basically God telling you your heart's not keeping up and your risk of dying starts to approximate 1% per month. There is no medical therapy for it. It's a mechanical problem, and you have to have your valve replaced. Traditionally, I've done that with open heart surgery, where we open your chest, stop your heart, replace the valve. We've developed a much less invasive way of doing this, transcatheter valve replacement, where I can go up through your leg, replace your valve without opening your chest, without stopping your heart. It's much less invasive. Most of my patients just go to a recovery room, to a floor. Most of them go home the next day. And most of them are completely normal by the end of a week. This represents a real advance for my patients with aortic stenosis who need treatment.
What can you tell me what you think is the cause of the disease? Why so many people have the disease?
Well, there's three reasons people get aortic stenosis. One is rheumatic heart disease. We really don't see that in this country. It's still endemic in underdeveloped countries. The second is called bicuspid aortic valve disease, where you're born with two cusps instead of three. That's about 2% of the population. But the other thing we see is what's called senile calcific degeneration. Basically, your valve has gotten old and worn out. And that's what we're seeing in my older patients, the ones who are often not really good candidates for surgery. And if we can do TAVR on them, it gives them a chance to recover much more quickly from surgery with a much lower risk. We've always known that TAVR has an advantage over surgery in early recovery and lower mortality. The question's always been, would that advantage hold up over time when compared to surgery once you get over the risk of surgery? And in the recent 4-year data from the Evolut low-risk trial, we showed that for the Evolut valve, not only did this early advantage persist through 4 years, it actually widened in favor of TAVR, which is the first and only valve that's shown this pattern. Again, really good news for my patients with severe aortic stenosis who aren't good candidates for surgery, who need a TAVR.
Who do you need to sit down and have this conversation with? Is it your heart doctor or your general practitioner? Where do you start?
Well, I think any of your physicians, your general practitioner doctor, is a good person to make the diagnosis. This aortic stenosis comes with a murmur that you can hear with your stethoscope very easily, and then you can get a non-invasive cardiac echo. It's a very simple thing to do, and they'll tell you not only how your valves are doing, but how the rest of your heart's doing. And if you have severe aortic stenosis, then you see your local cardiologist, and you start talking about what are the options. Are you a better candidate for surgery or a better candidate for TAVR, and why? And then you choose which route to go forward.
This question comes from the platform Instagram. People have the opportunity to hear and see me on multiple platforms, and they want to know when they go for their doctor's visit with their general practitioner, he always puts the stethoscope on them. What is he listening for?
He's listening for a murmur. A murmur is just a sound made by blood that has turbulent blood flow. And as you narrow your valve, it's like a narrowing in a stream. The blood has to go faster, and it's turbulent. That makes a sound called a murmur. And the murmur of aortic stenosis is fairly distinctive. And once your physician hears that, as I said, the next easy step is a non-invasive cardiac echo. It's an easy thing to do. There's no risk to you, and you know exactly what your valve looks like after that.
Thank you so much. Thank you, Poster, for that, because that was a great question. Where do we, Dr. Reardon, where do we go from here now that you have enlightened us? Where do we go from here about our heart?
Well, first of all, go to your local physician. Your local physician is the person on the spot to help you. But you can also go to myinteractiveasjourney.com. And at myinteractiveasjourney.com, you can learn a lot more about aortic stenosis and what your options of treatment are if you have aortic stenosis.
Dr. Michael Reardon, I want to thank you so much for the work that you do, and thank you for stopping by the Valder Beebe Show. My audience, you did not probably, I don't know if they familiarize you, is made up of people born between 1946 and 1964, known as baby boomers. And when I was looking at your information, many of them fall into that 5 million Americans diagnosed. So thank you so much for stopping by the Valder Beebe Show.
Well, Valder, as a fellow baby boomer, I'm happy to give you this information.
Have a great holiday. Thank you, Dr. Reardon.
Thank you very much for having me on.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.